Ladies and gentlemen, welcome to Global Health. This is your host, Dr. Selim Sılay, physician, entrepreneur, and venture architect. I'm really honored to host you with people from all walks of life, top physicians around the globe. And today, my host is an amazing physician, a top plastic surgeon, Professor Dr. Furkan Karapekmez. Furkan is a very special person for me. He's a great friend of mine. He has been trained in Konya and has done an amazing job and also get several education and rotations for more than 2 years in the United States in Rochester. He is actually now in Ankara Medical University, and also has a private clinic and getting patients around the globe from more than 50 different nations. He is really very principled person and a nice person, and today we're with him. Welcome, Furkan. So honored to have you.
Thank you very much. It's my honor to be your host, be your guest.
And
Thank you very much.
You know, I know how busy you are, and we're very excited to have you here at NTR TV. Thank you very much for your valuable time.
It's my pleasure. Okay.
Thank you. For our viewers, can you tell a little bit about who Furkan Karapekmez is? What excites you? What motivates you?
Okay. I'm a plastic surgeon. I'm working in the Ankara Medical University, plastic surgery department as a chief. And also I have a private clinic in Ankara. And I'm spending some time to teach medical students and other times in the clinics. And I also work in two different hospitals for my general anesthesia patients. And I like to treat patients and touch their life and help to improve their life quality in both functional and aesthetic way.
What is the most rewarding aspect of being a plastic surgeon? As a physician, what is the most rewarding aspect?
It's very nice to see when you change someone's life with improving their function and replacing sometimes function, or improving the self-esteem and getting back to some positive feedback in this way. If they say that I feel very confident now, or now I can do. One of my patients said I couldn't use this small seats before the surgery because my chin is backwards. After surgery, it's the first time I'm using this.
Oh my God!
Sunflower. Yeah. The first time I'm using this my
sunflower.
Teeth.
It's a special feeling.
Sunflower seat to use my teeth.
Oh my God.
I didn't know that this is very important for the young people, maybe 15 years old. It was very because you get a very big surgery to move the lower chin and the profile change, the function change, but it's very important things, small things, the sunflower seats, opening with the teeth.
You wouldn't care, you wouldn't even appreciate that.
You don't understand.
For him, it's the first time he's
something this like that, and the patient says that my life changed that day and this way, and also maybe some patient has very chronic wounds, maybe 1 year, and couldn't get rid of this wound. I used some skin graft closed, and after 1 month, he said, no swelling, no wound, no dressing. I'm very satisfied, I'm very happy. It's very touched. Some of the patients, they come with family, starting from the children, cleft left, cleft left, or faced cleft. Yes. And the patients growing and get another surgery. Now the patient is 15 years old. When they visit the family, they want to take a photograph with me. I have a lot of photographs with these patients. This 12 years old or 15 years old. At 3 years old, 1 year old, I did some surgery, cleft surgery. This patient grow up and then want to make surgery because he also know me. That's and amazing. He wants to take pictures with me. It's very rewarding to seeing that, touching the one's life and family's life.
This is amazing. But also, in addition to this amazing principles you're establishing, I'm very curious, what do you pay attention in order to achieve natural results in aesthetic surgery? Because I know you're very principled and you want to have a natural outcome. And what are the things that you pay attention to see this?
For example, if you give it one example, for example, rhinoplasty is the most common. And we use the technology, for example, we use an AI.
Rhinoplasty is nose job for our viewers, so basically correcting the nose. Yes.
Well, the inside is crystal clear. We can do whatever we need inside. The hypertrophy, septal deviation, inside, internal valve, external valve. But outside, we use some AI technology and some 3D image.
You're using artificial intelligence
We have
and
program.
3D imaging.
We have 3 or 5 pictures of the face, and this program is if 3 pictures within 5 minutes making 3D face. If 5 pictures in 20 minutes to takes a very high resolution 3D image of the face. And this face, we use this face to tell patients, okay, your face has some proportions and nose have proportions, and the normal is not one nose; it's very very big definition. And some patients normal definition might be very artificial for another patient.
Right.
And within staying the normal angles, we have to make sure the patient is like which side, staying in which side of this normal. And that's why we use this, and then we do the 1 simulation, 2 simulation, 3 simulation with the patients, lowering the bridge. For example, if for the male nose, and the tip to bridge relation can be straight, can be a little hump or bridge, or little down. It is a male. It's both 3 of this relation is normal. And when you do it in the patient's face within the 3D simulation program, patient says, "Oh, it's better," and then it's give a clue to us.
So you're getting feedback back from the patient.
Yeah, as a patient like the simulation too, or also the lip nose angles. For example, the man is supposed to be between 90 and 95, and the woman more than 95. But if you do more than 95 for men, it's going to be very, very artificial, non-natural. Within the natural angles, some patients I want 90. I don't want more. Some patients want 95. It doesn't mean we are going to guarantee this we can result, but we can see
you
that.
strive to go for
yes,
that.
Yeah, we will do the 90% is going to be like this. And if the patient's skin and internal structures allow us.
Of course.
That's why we do 1, 2, 3, 4. And when you see the patient's aim, okay, we will try to reach that. Again, we can go as far as we can.
That's amazing. So actually you are looking into that area and making sure you are able to achieve natural results while using technology.
Yeah,
and the AI and 3D imaging and getting the feedback of the patient to really make sure you achieve the best outcome. And I know you have all types of aesthetic surgery, from blepharoplasty to nose job or rhinoplasty to other body dysmorphia problems, as well as chronic problems, and also tummy tuck and different types of surgeries. What type of preparations do you recommend to your patients before the surgery?
Yeah, generally any kind of surgery, reconstructive surgery, flap, graft, tumor resection, or orthodontic surgery, chin surgeries, or ear on or nose surgery. Any type of surgery, we advise patients to quit smoking if they are smoking, because smoking has an effect of, for example, and it increases the secretion of the respiratory tract. That means the anesthesia risk is increased a little bit. And the normal young person has the ACA1 risk, which is the minimum risk anesthesia. Smoking alone increases anesthesia to 1 to 2. And also, for the rhinoplasty, we put some silicone spin to help the breathing on the first 3 days. And this smoking patients have secretion, close this silicone sheets, silicone tubes, and they cannot breathe. It is uncomfortable things. And also, smoking patients has too much bleeding because the nicotine itself make dilatation, the increasing the size of the vessels, and construction again. That means the swelling, bruising is going to be very, very much, and that's very uncomfortable also. And also, one last thing in the smoking, heavy smokers, hospitalization rates is decreased. For example, trauma, laceration, any cut
the
in the face.
The healing process takes longer, right?
For example, in the face cut, or when we stitch the face cut, within 5 to 7 days we can remove the stitches because the stitches is finished. But as heavy smoker, they make it 7, it become 10. We can remove late, and that means the scar is going to be worse. That's
so
why
the cells take longer time to regenerate and also to make sure it
that's
is
why the first
correct
common,
nicely, right? Yeah.
common things quit smoking. Well, some patients said, I don't smoke, but I use some electronic cigarettes.
It's
This is
worse
also,
than that.
There's also a problem.
Yeah.
And also some patients say, I use shisha. And shisha is also
Yeah,
has
they're all
very-
the same. Yeah.
And the second things, a lot of patients use some herbal medicines, and some most of the herbal medicine is good, but you need to be used carefully because the recent publications, 80% of the herbal supplements has increased bleeding that help to protect the heart disease for patients. But during surgery, before the surgery, at least 2 weeks before surgery, we need to quit herbal medicines. Also, green tea, and most of the teas, not black tea, but green tea and some of these increase bleeding time. That means a lot of bruising, a lot of hematoma risk. That's why you need to quit any herbal supplements
So
before.
what you eat, what you drink, everything has to be consulted, including,
Yes, yes.
of course.
Some of the foods also increase the bleeding. For example, I guess vitamin E also they increase the bleeding. That's why before the surgery we advise patients to stop using this to prepare the surgery. And if the patient has overweight, and most of the patient needs to be body mass index lower than 30 to have good result and the less risk of anesthesia.
So you ask them to lose some weight as well?
Yeah, lose some weight to get a better result and the less anesthesia risk.
I see. Well, these are very important points. It is also preparing the patient to have a better outcome of the surgery because they listen to it. So it's not like making sure these are applied before the surgery is very important.
Yes.
This is great. And I'm very curious because of the social media impact. Do you encounter body dysmorphia or in your patients that wants to do certain types of surgeries and insist on it?
Yes, many patients. I have many patients, and some of my colleagues they called me. My daughter is going to come to you, and she asked to removing some fat tissue in here, like a Hollywood cheek surgery. That means removing some fat tissue here. Sometimes we remove because there is fat tissue inside your face. Bichat fat tissue can decrease, and then the patient may have and bite the inner
problem.
Mucosa, bite the mucosa, and that means there's a lot of tissue is decreasing here. We can make a small incision, remove that. This patient also already get this surgery, but doesn't satisfy it and come to me to remove more. And I asked to father, okay, I convinced her to not touch. He said, please do surgery because if you didn't make incision, she's going to find some person maybe damage this nerve, and just look.
And with bad intention.
I know you don't make harm to remove more fat. You don't search. You just look. It's something you can remove. I think I tried. At least she may give up. I said, okay, I will say that. Otherwise, I said no to patient. She will seek another person to come find.
And hurt herself.
Yes, and if there is no fat tissue, if someone go too much, it might be harmful for the facial nerves.
Facial paralysis, all types of problems.
And also another patient I know want to rhinoplasty, but the nose very, very perfect nose. But the father said that later. She feel that she is fatty, but she's thin. She didn't eat and drink a lot of time, and sometimes they internet and the hospital to give some food supplement to IV in IUA. It's a very dangerous problem, and sometimes we couldn't understand. But we try to understand and ask questions. Expect someone else come with the patients to say similar things. And is patient alone, no relative with them.
It's very hard to figure out from the only patient.
Yeah, we will try to not get the surgery this patient, but most of them we see, but rarely we can do surgery with this patient with accident.
And this is very interesting. Thanks for sharing it. I'm also curious about, you talked about the preparations for the surgery. I'm very curious, what do you recommend to your patients during the post-surgery recovery process? They went through a nose job, a tummy tuck, or some type of surgery. What do they do to recover better?
Yes, generally in the first day, for example, in the face, In the face, we have the surgical operation of the broken bones also. For example, facial trauma patients. I had some patients that get a punch or some hit to eyes. When you get the trauma to eyes, the lower wall of the eyes is very fragile, and they broke easily to protect eye globe.
I see.
And then after that, patient has the sight is change, can see two. When you look up, the patient see two instead of one figure. And we need to go inside and put some plates.
So it's like double vision.
Double vision is correct. Double vision.
Yeah.
This kind of facial trauma, on orthodontic surgery and rhinoplasty, all the facelift, the patient has a lot of bruising and bleeding in their face. That's why in the postoperative period, it's very special. We give the patient a special ice packs, and the first 3 days has to apply ice pack and avoid excessive exercise to not increase the blood pressure.
Sure.
It's also increase the bleeding and swelling and hematoma. And also we advise to not smoking because smoking also increase.
That's true.
And
That's
3 days is resting, and then after that they can return the regular activity. And also the other, the body operations. The first 3 days they can do their eating and restroom needs, but other than this, we want them to rest. And after this first 3 days, they increase gradually their activity, and they go outside. But any operation that produce bruising, the bruising has to be protected from the sunlight, because the bruising, if see the ultraviolet light, it might be permanent stain in the skin. That's why in the first around 7 to 14 days change within the individuals, you need to protect from sunlight, either using some sun cream, sun blockers, or eyeglasses with this protecting ultraviolet. They need to protect their bruising from the sunlight.
I see. This is very important. So also the recommendations you give before the surgery, do they apply after surgery, like not smoking or making sure to keep your weight, or do they impact also the recovery?
Yes, the smoking after surgery, at least the first 1 week is very important, epithelialization and not breathing too much. The 1 week is okay. I advise patient before the surgery 1 week, after surgery 1 week, at least minimum, you need to quit. After 1 week, you can start and drink all the smoke, but as a doctor, I advise to quit. But at least for the surgery, because it's very important, you have to quit. And also the blood dilution effects, food supplements or any aspirin-like drugs has to be stopped before the surgery, and after surgery at least 5 days.
I see.
And some of the patient has to use some blood thinners because of protecting a special disease. And that's kind of patients, we use different injection before surgery. We quit this warfarin or aspirin, we use some injection.
Sure.
Low molecular weight injections. And after 1 week to surgery, we start to previous drugs again.
How about the drinks, like the herbal drinks or green tea?
Herbal drinks also. After 1 week, they can start. Especially the green tea, especially, is help to decrease the edema. That's why after 1 week, we advise to use. Before 1 week and within the first week, we said don't use green tea, but after 1 week, use green tea to decrease the edema very fast.
So it's very important for our patients to share whether they are using complementary medicine or other things, to share with your surgeon.
Yeah, the surgeon has to ask, because sometimes patient doesn't know it is important. They didn't mention. If you are using any drugs, drug they can say, but the supplement they don't think that there is a drug. And you need to ask, do you have a supplement? And they said, do you use any vegetable or any tea? Do you use green tea? You have to be very specific. Otherwise, they say, okay, I use it. That's why the surgeon has to be careful and ask specific questions.
Well, we've come to the end of our show. I want to thank you again. You're so loving. We're receiving so many good feedback from African viewers about, we want to see Dr. Furkan. He needs to be on the show. So I want to tell you that you have a huge fan of Africans. around the globe.
Thank you very much.
And we look forward to hosting you in different episodes.
Very
What
happy.
are your final words before we close the show?
Okay, I want to thank you, our viewers, and it's very important to have a connection with the whole African countries in our country. We have a special bond within these people and us, and I hope to see them, or I hope to continue these programs with you.
Thank you. Thank you so much for
You're
coming.
welcome.
It's such an honor having
You're
you.
welcome. It's my
Ladies
pleasure.
and gentlemen, this is the end of our show. This is your host, Dr. Selim Tılay, physician, entrepreneur, and venture architect. See you next time in another amazing episode of Global Health. Take care and all the best. Bye.